Hello everyone, my name is Tyler Morimoto, and this is my presentation on healthcare reform, specifically within the United States. Healthcare reform is a very controversial topic within the United States. Our current healthcare system is in a state in which it is both not easily accessible and costly. It is generally agreed upon that we need healthcare reform, but many are unsure of what can be done to achieve it. In order to improve our healthcare system through reform, we must fulfill 3 steps, which I will cover throughout my presentation. The first part of my presentation will discuss how we can organize and finance our healthcare system to provide universal insurance coverage. I will suggest 2 possible solutions as well as the pros and cons for each solution. The second part of my presentation will cover how we can improve the quality of healthcare as well as our population health status. And finally, the third part of my presentation will discuss how to best decrease the inflation rate for healthcare spending. I will begin by discussing universal insurance coverage. Universal insurance coverage, as defined by the World Health Organization, is a system in which all people have access to the health services they need, when and where they need them, without financial hardship. The first solution that I would suggest would consist of a predominantly public insurance program. This program would be a classic single-payer model in which the government finances healthcare with general tax revenue and employs or contracts directly with health providers to deliver care. The pros to this type of insurance system would be lower administrative costs. The system would also provide more equitable coverage across all U.S. residents. On the other hand, a con would be that there would be less flexibility in terms of choosing medical service providers. The increased access to public insurance would also lead to delays in elective processes. My alternative solution would implement a pluralist system, which would be a mixed public and private insurance program. This would be a system in which taxes support the health insurance funds that provide coverage financed by the government. Along with this public insurance, there would be an optional private complementary insurance that would be available. The pros to the system would include more flexibility when it comes to choosing doctors or medical facilities, as well as more plan options to choose from. On the negative side, the cons would include greater administrative costs and less equitable coverage. Both suggested insurance programs would allow access to universal insurance coverage, which would be one step closer to a greater healthcare system. Next, I will be discussing how our healthcare system can be adjusted to improve the quality of care as well as the population health status, both on the micro and macro level. I will be discussing the 5 priorities to improving quality of care and population health status as proposed by the Agency for Healthcare Research and Quality. The first priority stresses the importance of person and family-centered care. This priority focuses on ensuring that each patient as well as the patient's families are engaged and aware of the care that they are accepting. This priority goes hand in hand with the next priority, which is care coordination. Care coordination promotes effective communication both between healthcare workers and within the discussions between healthcare workers and patients. Priority 3 highlights effective prevention and treatment. This priority focuses on implementing preventative care as well as promoting the most effective treatment practices to combat the leading causes of mortality. For example, heart disease has been known to be a leading cause of death in America for decades. Effective prevention and treatment would put the focus on utilizing all preventative measures. Priority 4 is healthy living. This priority focuses on the increased promotion of healthy lifestyle behaviors. This can be done by implementing more organizations and campaigns focused on promoting a healthy lifestyle. Some examples of these organizations are the American Association for Physical Activity and Recreation, as well as the National Association of Health and Fitness. A healthy lifestyle can help reduce the need for healthcare, relieving the healthcare accessibility issue. The final priority is care affordability. Making healthcare more affordable would also make healthcare more accessible. This can be done by implementing new healthcare delivery models. There are also other measures that can be done to make care more affordable that I will be going over in the next section. Many of the issues regarding the accessibility of healthcare all stem from the same issue, that healthcare is just expensive in America. The third and final part of my presentation will discuss how we can organize and finance our healthcare to decrease the inflation rate for healthcare spending. I will be discussing the 4 suggested ways to reduce healthcare costs as proposed by the American Journal of Medicine. The first way to reduce healthcare costs would be to reduce administrative costs. According to James E. Dalen of the Journal of Medicine, we spend more than a third of our healthcare dollars on overhead and administration, such as billing, advertising, profits, and bonuses for healthcare executives. Because of this, our administrative costs are double that of Canada, a country that implements a single-payer system. The second way to reduce healthcare costs would be to put more focus on preventative care. In order to do this, we must implement more primary care physicians, family physicians, and general internists. Multiple studies have shown that generalists practice more cost-effective medicine than specialists. Their patients also have better health outcomes. This shift from specialists to generalists would help change our focus from disease management to prevention and health promotion. The third way to reduce healthcare costs would be to eliminate unnecessary tests and procedures. Currently, we see that there are major inconsistencies when it comes to the usage of expensive diagnostic tests and treatments by physicians. According to the Dartmouth Institute for Health Policy and Practice, the average cost of treating a Medicare patient in some parts of the country is twice as expensive as in other areas. However, there is no evidence that more expensive treatment benefits patients. Because much of the excessive treatment occurs at the end of life, we must encourage all citizens to have living wills in order to prevent unwanted procedures at the end of life. The fourth and final way to reduce healthcare costs is to have our government control the costs of prescription drugs. Nearly every nation controls the prices of prescription drugs. However, in America, drug companies are allowed to charge whatever they wish. Because of the high cost of prescription drugs, many Americans with chronic illnesses are unable to take their medicine due to the fact that they can't afford it. This leads to increased emergency room visits and hospitalizations, and a further increase in our healthcare costs. In conclusion, we must provide universal insurance coverage by implementing either a predominantly public insurance program or a pluralist system. We must also work to improve the quality of care and the population health status by creating a more consistent and accessible healthcare system. Finally, we must strive to decrease the inflation rate for healthcare spending by reducing unnecessary costs and taking preventative measures. There is no such thing as a perfect healthcare system. However, there are definitely things that our healthcare system can improve on. It is important to be consistent and active in our promotion of universal healthcare. In that way, we can set goals for a better future. That will conclude my presentation on healthcare reform. Here are my references. Thank you all for listening.